I'm Dr. Jitender Kumar Mokta, and I am Professor Internal Medicine, Indira Gandhi Medical College, Shimla. What have we seen in our study? The patient who is given doxylate in their after development of the fever, either they present late or the doxy is being instituted late. Late means after 5 days of the onset of the fever, the patient present with complication. Most of the time the patient present with different organ failure. And the most common cause of the death or mortality or different organ failure, more hospital stay and more cost, is the delay in the institution of the therapy, that is in the form of doxycycline. And what has been written in the textbook, that is a typical of Harrison's textbook of the medicine, during this season we should, till we do not make the diagnosis, we should give the cocktail for the treatment of lepto, for the treatment of your scrub, and for the treatment of, if patient has got alteration sodium, even for the herpes simplex virus. So what we should do, like in our state, I will say most of the time we have got lepto, we have scrub, we have got dengue. With dengue, for we do not have any antibiotic, but at least for these two, till the diagnosis is not made, we should try to emphasize the early use of doxycycline and ceftriaxone. The use of ceftriaxone will cover the leptospirosis, will cover the enteric fever, and doxy will cover your scrub typhus. The most common cause of the mortality is the delay in the treatment. So I will tell to my primary care physician, during this season, if somebody is come with fever, until proven otherwise, we should give the patient, particularly where we have got a high incidence of scrub typhus, we should try to give at the early, till the diagnosis, definite diagnosis is not given, the early institution of the scrub by doxy, and early treatment of your leptoenteric by giving the ceftriaxone. If the clinical condition favors, like alteration sodium with your seizures, I will say add acyclovir in the armamentarium of the treatment. We will save a lot of patients if we follow these simple rules, rather than going for very heavy or very costly diagnostic approach. Thank you for the kind concern. Thank you very much.